everybody. My name's Becky. I'm with Respiratory Therapy here at Doctors. I've been here for about 6 years, but a therapist for 30. I'm just here to show you some of the basic oxygen devices, and then I'll just touch on our BiPAP and our heated high flow, just so you guys have a basic understanding. I know for some of you, you probably already know all of this, especially if you're a seasoned nurse, but for those of you that are new grads, this will be a good kind of refresher for you. So I'm gonna start with like the basics, which is just a regular nasal cannula. This runs at 1 to 6 liters. Once you get above 4 liters, you're gonna go ahead and wanna put a humidifier bottle on there. So that looks like this. It comes separate. There's a little tab on top here that pops off and a little one here that pops off. And then this just screws onto the top. And then you take the Christmas tree off of the flow meter. Thread that on there, which can be difficult sometimes, especially on the 3rd floor here at Doctors because their flow meters are kind of down. So yeah, you're just gonna hook up your oxygen to that. And if it's above 4 liters, just go ahead and add that humidifier bottle. This here, other than our non-heated high flow, these are the only 2 devices you're gonna have a humidifier bottle on. Other than that, you're not gonna have humidity on there because it's a high flow. The other ones are high flow devices, and you can basically explode this bottle and you're not gonna deliver the right amount of oxygen. So just FYI. I'm gonna take this off here. So the next one we go over, this is the non-heated high flow. You don't ever want to put more sterile water in it than past that line there, because if you're running it at 15 liters, it's going to end up spitting out of your cannula, and patients don't like that. They don't like water going up their nose. And then these aren't threading on here very well, but yeah, this flow meter is like sideways. Anyway, I'm just gonna leave it because it's not working properly. So this one, again, you're gonna fill it to that line or just below. This one runs at anywhere from 6 to 15. Once you get below 6, you're probably just gonna wanna switch it over to the other humidifier bottle that I showed you first. And this is nice for, it's that go between. 6 liters isn't enough, but they don't need to be like on a non-rebreather or a heated high flow. This is just that nice go between, and it's nice because it has that water bottle on there. Keeps them from drying out with all that flow. All right, on to the next. We have our oximizer. You're not gonna see these much anymore because since we got the high flow devices, they kind of took the place of this. And the reason it's the high flow is more desirable is because of that humidity. These cannot be humidified. So you'll see this little pendant here. If you do have a patient on one of these, you want the holes to go in the front, and you want to make sure this is running at between 6 to 15 liters. The paper says 12, but this can go on up to 15. And what this does is basically it doubles the oxygen that they're getting. So you're gonna chart it at a 6-liter oximizer, but what they're really getting is 12. So they're getting double the amount of flow that you put in there. So really when they're getting 15, they're getting more like 30 as far as like the FiO2 goes. Like I said, no humidifier on this one. The other thing that's not desirable about this is the length. We can't put like a, we can't adapt with an extra length of tubing. So they're kind of tethered to the bed or to their chair with this one. But yeah, we do have these. We just don't use them very often these days. All right, keeping it simple. This one's the Oxy mask. And we're gonna have to fix this. The sheet says run at 6 to 15 liters a minute. You can actually run these all the way down to 1 liter. And most of these devices, just FYI, they are gonna have, like this one has, if you guys can see this, it tells you on here what each liter flow gives you for FiO2. That way you kind of have an idea of what percentage of oxygen they're on. These are nice because they have these nice big holes. So the patients that are claustrophobic tend to like these better. They can also like drink through straws with these on and everything. So they've gotten pretty popular. We use these quite a bit. These also cannot be humidified though, again. And if you ever have a question about the humidification, just call us or ask somebody. Don't wing it with oxygen ever. You have to know what you're doing, and we don't mind helping. Just ask, okay? Or ask your charge nurse or somebody. Hi.